health services too are not appropriately distributed or are accessible in urban areas. Many times we feel that urban areas are going to have more of health professionals, more doctors, more nurses, etc. So why on earth are health services not going to be adequately available? But there is a huge maldistribution in urban areas. The poor are unable to access good quality health services because of differential concentration of health professionals as well as financial barriers to access of good health services. Quite often they depend upon informal healthcare providers who are not qualified, ranging from quacks to poorly trained healthcare providers, and many times their health suffers as a result of poor management of their health problems. And the contrary is also true, that they do seek treatment for minor ailments too in large hospitals, which makes the hospitals overcrowded. That's because primary care services are not well organized in health services. And if they do seek health care, they often get impoverished in the absence of universal health coverage. So one of the things that is missing in many of the low and middle income countries is financial protection apart from quality of health care. If they actually are going to become poorer or get crushed into poverty further because of unaffordable health care, then that itself is a cause of huge health inequity. And organizing urban health services to provide assured access, quality, as well as affordability, especially in the slum and low-income communities, is absolutely critical. But at the same time, we ought to ensure that there is greater coordination between city planning and health planning, whether it is housing for everybody, including low-income housing, whether it is safe cycling lanes, safe pedestrian pathways, well-lit streets where people can walk without fear of crime or the risk of falling into potholes, clean and green community spaces where they can exercise, public transportation which is likely to be available, and promote active living. All of these are going to be important elements of city planning. Unless you have a good land use mix, street connectivity, look at residential density as an element of promoting active living, prevention of crime so that people can actually exercise safely, all of these are going to be coming into city planning. And if this is not paid attention to, then health will suffer. Therefore, what we need now is a much greater coordination between urban planning, which is traditionally in other sectors outside of health, and health planning. Then we also need a greater integration of health services. Unless that happens, we'll have vertical programs functioning in silo. Then we need to promote greater access to disadvantaged communities, both in terms of physical access as well as financial affordability, and also provide greater education so that they know what kind of services need to be accessed to increase the demand generation from the poorer sections of the people who need those health services. We also need to bring in urban health related awareness into health professional training. A large number of healthcare providers and public health professionals are still not familiar with some of the special features of urban health planning. They are still rooted in terms of looking at traditional healthcare models and traditional public health systems. So even professional education of health professionals and healthcare providers needs to be transformed. But most important, we also need to make sure that urban local bodies and administrators, municipal authorities, all of them become much more alive to the need of protecting urban health, whether it is food safety or whether it is clean water and sanitation or whether it is ensuring urban primary care services. Unless urban local governance becomes more responsible as well as more accountable, we are not going to see urban health in a good shape for years to come. But cities also provide the solution, because the sheer size of the cities and their urban aggregation, as well as their access to technologies, including information technology, makes it easier to do things on scale. We can actually build water and sanitation services to scale, we can build health services to scale, and integrate all of them in a manner that we can actually ensure both healthy living as well as appropriate and affordable health care.